per day by the 19th. And again, as we predicted, we're seeing rising hospital admissions, and we must reconcile ourselves, sadly, to more deaths from COVID. In these circumstances, we must take a careful and a balanced decision. And there's only one reason why we can contemplate going ahead to step 4 in circumstances where we'd normally be locking down further, and that's because of the continuing effectiveness of the vaccine rollout. When we paused step 4 a few weeks ago, we had 2 reasons. First, we wanted to get more jabs into people's arms, and we have, with over 45 million adults now having received a first dose and 33 million a second. That is a higher proportion of the adult population of any European country except Malta. And our expectation remains that by July 19th, every adult will have had the chance to receive a first dose, and 2/3 will have received their second dose. And the second reason we paused was because we wanted a bit more time to see the evidence that our vaccines have helped to break the link between disease and death. And as the days have gone by, it has grown ever clearer that these vaccines are indeed successful, with the majority of those admitted to hospital unvaccinated. And Chris and Patrick will show the data highlighting the greatly reduced mortality that the vaccines have achieved. So as we come to the 4th step, we have to balance the risks. The risks of the disease, which the vaccines have reduced but very far from eliminated, and the risks of continuing with legally enforced restrictions that inevitably take their toll on people's lives and livelihoods, on people's health and mental health. And we must be honest with ourselves that if we can't reopen our society in the next few weeks, when we will be helped by the arrival of summer and by the school holidays, then we must ask ourselves, when will we be able to return to normal? And to those who say we should delay again, the alternative to that is to open up in winter, when the virus will have an advantage, or not at all this year. And so, again, without preempting the decision on the 12th of July, let me set out today our 5-point plan for living with COVID, in the hope that it will give families and businesses time to prepare. First, we will reinforce our vaccine wall, reducing the dose interval for under 40s from 12 weeks to 8, so that everyone over 18 should be double jabbed by the middle of September, in addition to our autumn programme of booster vaccines for the most vulnerable. Second, we will change the basic tools that we have used to control human behaviour. We'll move away from legal restrictions and allow people to make their own informed decisions about how to manage the virus. From step 4, we will remove all legal limits on the numbers meeting indoors and outdoors. We will allow all businesses to reopen, including nightclubs. We will lift the limit on named visitors to care homes and on numbers of people attending concerts, theatre and sports events. We will end the 1 metre plus rule on social distancing and the legal obligation to wear a face covering, although guidance will suggest where you might choose to do so, especially when cases are rising and where you come into contact with people you don't normally meet in enclosed spaces, such as obviously crowded public transport. It will no longer be necessary for government to instruct people to work from home, so employers will be able to start planning a safe return to the workplace. There will be no COVID certificate required as a condition of entry to any venue or event, although businesses and events can certainly make use of certification, and the NHS app gives you a COVID pass as one way to show your COVID status. Third, we will continue from step 4 to manage the virus with a test, trace and isolate system that is proportionate to the pandemic. You will have to self-isolate if you test positive or are told to do so by NHS Test and Trace. but we're looking to move to a different regime for fully vaccinated contacts of those testing positive, and also for children. And tomorrow, the Education Secretary will announce our plans to maintain key protections, but remove bubbles and contact isolation for pupils. Fourth, from step 4, we will maintain our tough border controls, including the red list, and recognising the protection afforded by 2 doses of vaccine, we will work with the travel industry towards removing the need for fully vaccinated arrivals to isolate on return from an amber country, and the Transport Secretary will provide a further update later this week. Last, we will continue to monitor the data and retain contingency measures to help manage the virus during higher risk periods such as the winter. But we will place an emphasis on strengthened guidance and do everything possible to avoid reimposing restrictions with all the costs that they bring. As we set out this new approach, I'm mindful that today is the 73rd anniversary of our National Health Service, and there could not be a more fitting moment to pay tribute once again to every one of our NHS and social care workers. And the best thing we can do to repay their courage and dedication right now is to protect ourselves and others and get those jabs whenever our turn comes. Thank you very much. I'm now going to ask Patrick to do the slides.
Thank you. Can I have the first slide, please? This slide shows the number of people testing positive for COVID from the 1st of September last year through to today. What you can see is that obviously we had a peak in November, a big peak around January and February, and we are in the middle now of another increase in cases. It's going quite steeply. The most recent 7-day average is 25,447 cases. Today we saw 27,334. So the number of cases is increasing. The doubling time is roughly 9 days. It's mainly amongst younger people, but spreading up the age groups. And the Office for National Statistics estimate that roughly 1 in 210 people are now infected with COVID, approximately 250,000 people. So there's no doubt we are now facing an increase in case numbers. Next slide, please. This slide shows the number of people in hospital, and again it goes from the 1st of September through to now, and what you can see is that there was again the peak of hospitalizations in November and a big peak in January and February. But in contrast to the very sharp increase in cases, we have got an increase in the number of people in hospital, but it's not so steep. And you can see that there are, as of July the 1st, 1,905 people in hospital with COVID-19. 358 people were admitted yesterday. The doubling time is slower than for cases, so it's not rising as fast, but the hospitalizations are rising and rising quite steeply in some places, and we would expect them to continue. So essentially what this shows is that the vaccines have weakened the link between cases and hospitalization, but it's a weakened link, not a completely broken link. And we will still see increases in hospitalisation. And as the cases get much higher, you would expect the hospitalisations to increase. Next slide, please. That is even more evident when we look at deaths. And again, the same slide format from the 1st of September through to the through to date. And what you can see is the large number of deaths that occurred. And the first peak is illustrated in the dotted lines. You can see how it relates to the first peak. And if you go to the right-hand part of the slide, you can see it's even difficult to see an increase in the number of deaths at the moment. But, and this is an important but, the deaths are increasing. They're at low levels, but there's an increase in deaths just as there's been an increase in hospitalisation. And we would expect that to continue also as the number of cases increases. So again, to reiterate, cases going up, the link between cases and hospitalizations and cases and deaths is weakened, but not completely broken, and we would expect to see some further increase. Next slide, please. The number of people who've received vaccination is high, of course, across the country, and that's true for both first and second dose. And overall, for first dose, something like 86% of the population over the age of 18 have had a first dose, and a larger number of people, because of the pause that was put in place, a larger number of people have now had second dose as well. So we've got a high level of vaccination coverage, again, making it more difficult for the virus to spread in these groups and protecting in terms of hospitalizations and deaths. And I think the message from this set of slides are twofold, really. First, if you haven't had a vaccination and you're eligible for one, get a vaccine. Make sure you get the second dose. And second, that we are in the face of an increasing epidemic at the moment, and therefore we need to behave accordingly in terms of trying to limit transmission spread. Thank you.
Thanks very much, Patrick. Anything to add at this stage, Chris? Thank you very much. Let's go, first of all, to members of the public. We have Aaron from Kent.
We have figures which tell us how effective the vaccines are to hospitalisations and deaths. But how effective is the vaccine to preventing long COVID or lessening its effects? Thank you.
Thanks, Aaron. I'm going to, I think, ask our scientific. I'm going to ask Chris to answer that.
Thanks, Prime Minister. I mean, I think at the moment, Aaron, the data are not really clear. I think we are confident that because the vaccines prevent people from getting COVID in a very high proportion of cases, that, of course, is a protection against long COVID, which is itself several different syndromes, almost certainly. And if lots of people are vaccinated, that reduces the risk of transmission in the community. It's one of the reasons why, as the Prime Minister said, vaccinating yourself protects yourself, but also those around you. So that also helps protect. But we do not yet know whether those people who have been vaccinated and then get COVID, whether it weakens or breaks the link between that and long COVID. And I think that those data will come out over the next few months.
Any lad?
No, I think that's right. I mean, because vaccines reduce severe disease as well, and we know that some part of long COVID is associated in people who've had severe disease, I think there's a reasonable expectation that that bit's going to be diminished. And as Chris said, we'll find out over time the effects on the overall profile of long COVID.
Thanks very much, Aaron. Anita from Greater London.
Hello. You said that we will hopefully be able to live with COVID like flu, and that we have a very good vaccination programme for flu. Presumably, part of the success of our flu vaccination programme is the inclusion of children. Therefore, will you be making the COVID vaccine available to all children, should they wish to receive it in the near future? Thank you.
Thanks, Anita. Well, I know that the JCVI is looking at vaccinating children, but Chris, would you like to answer that one?
Thank you. So it's a really important question, and what we're really trying to work out at this point in time is the relative protection that the vaccines provide for children, but I think we're very confident that vaccines would protect children to a high degree. But the second thing you need to know with all vaccines is about safety, and this is the question that JCVI are rightly taking time to make sure they get all the data before they give final advice. Because for any vaccine, what you want to be confident of is that the benefits of the vaccine outweigh any risks of the vaccine for the children involved. And this is true also, obviously, for adults. Because children have such a much lower rate of severe outcomes from COVID, and this is one of the few good things with COVID, they have a very much lower rate of poor outcomes, with the exception of a small number of children who've got things like neurodisability. Therefore, we would need to have even greater confidence about the safety, because the risk-benefit is potentially therefore going to be more marginal. So that's the reason why JCVI is rightly taking its time to get the evidence from around the world, so that when we give advice, we can either say with confidence that it is safer for children to be vaccinated than to get infection, or alternatively the other way round. But that data is coming in and will come in from other nations which are going a little ahead of the UK in terms of vaccinating children.
Thanks, Anita. Let's go to the media. Vicky Young, BBC News.
Prime Minister, you said you wanted to be honest with people, and you've talked about the expected rise in cases, more people in hospital, and sadly more will die. Can you tell us how bad you expect it to get after July and the restrictions being lifted? And to Professor Whitty, are you confident that hospitals can cope with this wave of cases? And to all three of you, in what circumstances would you continue to wear a mask?
Well, thanks, Vicky. I think the answer is that obviously we have to be cautious, and we will continue to look at all the data as we progress. But don't forget that we always did say there would be a third wave, and the projections when we outlined the roadmap were for sadly more hospitalisations and sadly more deaths. I think the question that people have to ask themselves, as I said earlier on, is if we don't go ahead now when we've clearly done so much with the vaccination programme to break the link between infection and death. If we don't go ahead now when the summer fire break is coming up, the school holidays, all the advantages that should give us in fighting the virus, then the question is, when would we go ahead, particularly given the likelihood the virus will have an extra advantage in the colder months in the autumn and the winter. So we'd run the risk of either opening up at a very difficult time when the virus has an edge, has an advantage in the colder months, or again putting everything off to next year. So I do think it's going to be a very balanced decision next week. I want to stress that this is what we're really doing today is setting out the conditions that we expect us all to be in from July the 19th. We're not taking the final decision until July the 12th. And on your question about will I personally wear a mask? I think that, as I said earlier on, it will depend on the circumstances. And I think that what we're trying to do is move from a universal government diktat to relying on people's personal responsibility. And clearly there's a big difference between travelling on a crowded tube train and sitting late at night in a virtually empty carriage on the main railway line. So what we want to do is for people to exercise their personal responsibility, but to remember the value of face coverings, both in protecting themselves and others. But I know that Chris and Patrick want to add to that.
Shall I answer the NHS question?
Yes, sorry.
And then I'll talk about my view, masks. Patrick will add his. I mean, the NHS is an emergency service. So at one level, the answer is it will cope with anything because it is an emergency service. But we, as Sir Patrick pointed out, there is now a doubling time for numbers of cases going into hospital. The number of cases that's going in a day at the moment is relatively low compared to previous waves that are around about 300. But if you double up and then double up and then double up and double again, at a certain point you get, and in fact in a surprisingly small number of doublings, you get to really quite high numbers. So the question is, at what stage along this path are the doublings times getting to the point when the numbers are very high before we actually lead to a reduction, because the peak of the epidemic happens. And what the modelling would imply is that we will reach that peak before we get to the point where we have the kind of pressures we saw in January, for example, of this year. But inevitably, with all models, you have to say there is some degree of uncertainty. And so, we are dealing with uncertainty, and the Prime Minister and Ministers are having to make difficult decisions with uncertainty as part of the decision process. In terms of wearing a mask, I would wear a mask under three situations, and I would do so particularly at this point when the epidemic is clearly significant and rising. And the first is in any situation which was indoors and crowded or indoors with close proximity to other people. And that is because masks help protect other people. This is a thing we do to protect other people, as it's by far its principal aim. The second situation I do it is if I was required to, by any competent authority, I would have no hesitation about doing that, and I would consider that was a reasonable and sensible thing if they had good reasons to do that. And the third reason is if someone else was uncomfortable if I did not wear a mask, as a point of common courtesy, of course I would wear a mask. So under all those circumstances, I would do so.
I've not got much to add. I exactly the same in terms of mask wearing. And just a reminder, masks are most effective at preventing somebody else catching the disease from you. They have some effect to prevent you catching it as well. And the situation you're most likely to catch COVID in is indoors, crowded spaces. So that's the obvious place where mask wearing becomes an advantage.
Great, thank you. Romilly Weeks, ITV.
If I could ask Professor Whitty, first of all, we're only 3/4 of the way through the vaccination programme. Cases are at the highest level since February. Why not finish vaccinating all adults before this significant unblocking? And to the Prime Minister as well, many scientists and doctors' organisations are suggesting that measures like mask wearing must be kept in place in order to alleviate pressure on the NHS. Why are you ignoring their concerns?
I mean, on the first one, firstly, to make the obvious point that decisions are made by ministers, not by scientific advisors or medical advisors. But within the scientific views on this, there was a really clear consensus that under all circumstances, some degree of further social distancing will be need to be maintained even after the restrictions are lifted in law, and that's been part of the roadmap all the way through, and that is widely supported by the scientific views. There was a pretty high degree of scientific agreement that the delay of 4 weeks that ministers chose to take was an extremely sensible thing to do, and I think the fact that things have played out as they have, I think, reinforces that. But the view is more mixed about exactly what the right timing is from a technical point of view, even before you get into issues that the Prime Minister has to deal with more widely. And these really come from the fact that at a certain point you move to the situation where instead of actually averting hospitalisations and deaths, you move over to just delaying them. So you're not actually changing the number of people who will go to hospital or die. You may change when they happen. And there is quite a strong view that by many people, including myself actually, that going in the summer has some advantages, all other things being equal, to opening up into the autumn when schools are going back and when we're heading into the winter period when the NHS tends to be under greatest pressure for many other reasons. So it's a very much more difficult technical decision now, even before ministers have to grapple with all the other things, than it was in terms of the 4-week delay, where I think there was a very substantial degree of scientific agreement.
And Romilly, just on your point about masks, I return to what we're trying to do with step 4 of the roadmap, which is get away from government legal diktat to relying on personal responsibility. And I do think that I will obviously wear a mask in crowded places where you're meeting people that you don't know, as Chris was saying, to protect others and as a matter of simple courtesy, but there's a difference between that, and I think everybody can understand that, and circumstances where you're finding yourself sitting alone for hours late at night on a train with no one else in the compartment. There I think people should be entitled to exercise some discretion. Beth Rigby, Sky News.
Thank you. Prime Minister, you promised a cautious but irreversible route out of lockdown. And now you're about to get rid of all restrictions, a big bang approach, even as, to quote Chris Whitty there, we're in the face of an increasing epidemic, so the need to act accordingly to limit transmission, and yet you're doing away with all those safeguards. I put it to you that many people will see that not as cautious, but as reckless. And I also put it to you that you just don't seem to be committing to irreversibility either. You just said that you will do everything possible to avoid reimposing restrictions in the winter. So is this cautious or irreversible? And to Professor Whitty, you said at the beginning of the year it might be necessary to reintroduce some restrictions over the winter, What is your view of that now, given the Delta variant and the vaccine? You said that back in January and so much has changed. And does the Big Bang unlocking this summer now make more restrictions in the winter more or less likely in your view?
Well, Beth, I think that with great respect, obviously, to you, we can't say that I'm being both incautious and also abandoning irreversibility. What we want to do is strike the right balance, and we are trying to move from a system of very elaborate government rules to one in which we rely on people to exercise personal responsibility to follow guidance, mindful that, as I say, this pandemic is far from over. What we have achieved with the vaccine rollout has put us in a very strong position by comparison with many other countries in terms of the wall of protection that we have. But we must remain cautious, and I think that's why I'm asking people to think in that way. This is. I don't want people to feel that this is, as it were, the moment to get demob happy. This is the end of of COVID. It is very far from the end of dealing with this virus, and I hope that that's been clear from everything that you've heard from this press conference today. And on the irreversibility point, obviously, if we do find another variant that doesn't respond to the vaccines, if heaven forbid some really awful new bug should appear, then clearly we will have to take whatever steps we need to do to protect the public. But on balance, given the massive success of the vaccine rollout, given the fact that this is a propitious moment, a good moment to do it, given the coming summer holidays, the natural fire break we have there, and given the difficulty of then imagining us opening up in the context of the colder autumn winter months, I think this is a balanced and a cautious approach.
In terms of, you asked two questions. I mean, on the first one about the winter, I thought at the time I made a deeply uncontroversial statement, which is respiratory infections are more likely to surge in the winter. That seems to be true for the great majority for a lot of obvious and some less obvious reasons. So the winter is inevitably going to be tricky. And this winter, the NHS is likely to have both COVID and some resurgence of other respiratory viruses that were suppressed by the degree of lockdown last time round. So I think we should be realistic. This coming winter may be very difficult for the NHS, and I don't think that's a particularly controversial statement. In terms of things now which would make that more or less likely, I think the thing which is against us, unfortunately, is not so much decisions by government, but the Delta variant is more transmissible. And that does make life more tricky. Anything that was difficult before gets that much more difficult with a more transmissible virus.
Thanks, Beth, very much. Jane Merrick, the Eye.
Quickly.
Jane, are you there?
Yes, sorry. Thank you, Prime Minister. First of all, there was a study last week from UCL that was published showing the incredible mental health and education attainment damage to children. So can you guarantee that even if you have to reimpose any restrictions next winter, there will not be school closures en masse? And to Professor Whitty or Sir Patrick, do secondary school age children need to be part of the vaccination programme in order to achieve population immunity?
Thanks very much, Jane. On your really good point about the damage to children's education, we are doing everything we can to minimise that. We've got a massive catch-up plan, as you know. But I think what a lot of people want to see, a lot of parents, a lot of teachers, a lot of pupils want to see is a different approach to outbreaks in schools, and we will be making sure that the Secretary of State for Education will be announcing later this week how we're going to move away from the sending bubbles home, move away from contact isolation for pupils, so to greatly to reduce the impact on schools of COVID outbreaks in those schools, and obviously the way forward is by testing rather than sending the bubbles home. But Patrick.
Yeah, on the vaccine, clearly the higher proportion of the population vaccinated, the greater the protection against spread, and that's just true across all parts of the population. But the question in children is the one that Chris addressed earlier on, which is the relative risks to the individual from vaccination versus the relative benefits in terms of avoiding problems associated with COVID. And that is the balance which JCVI need to strike in terms of getting data on those comparative risks for children. The higher the degree of immunity across the population, the greater the barrier to spread. But that's a different question from which children should be vaccinated and when, which we need to wait for the JCVI to give us views on.
Thanks, James. Mesa Hall, The Express.
Thank you, Prime Minister. Professor Whitty, if I could ask you first, you talked about the possibility of resurgence of other respiratory diseases this winter. Can you see any prospect of COVID-style restrictions, such as school closures or maybe compulsory masks, being used to protect the NHS from being overwhelmed by flu cases? And Prime Minister, you talked about employers starting to organise a safe return to work for employees who've been working from home. Some businesses would like to hear a very strong message that people need to get back to city centres to get the economy going again. Is your message to people to now get back to the office, or once we go ahead with ending the roadmap? And is the end of your roadmap, are you optimistic that that is the point that the economy will start roaring back into life?
Thanks.
Taking the kind of really strong measures that were necessary for a pandemic of the scale of COVID. Now, obviously, if there was a flu pandemic, and if we think back to the 1918-19 flu pandemic, that was something that was on a really colossal scale. That's a different situation. But for the seasonal flu that we deal with every year, I would be very surprised if society was wanting that to happen. But what we have demonstrated is that by simple measures, which we really must stick to for COVID, washing hands, covering mouth when coughing, all those things like that, we really must be doing those, and anything we do which helps to reduce the risk of COVID to ourselves, our families and those around us will also reduce the risk of other respiratory infections, including flu.
Yeah, Mesa, so just on your couple of points, the key thing is the government is no longer telling people that it's necessary that they should work from home, and the rest is really for employers to work out for themselves. But that change has been made possible by the success of the vaccine rollout. The overwhelming proportion of the workforce that has now had 2 jabs, and don't forget that by the 19th, I think everybody over 40 will have had 2 jabs. Everybody over 18 will have had 1 jab. So talking about a huge wall of immunity. And on the recovery, I think it will be a strong recovery, and you're already starting to see it, and that has been made possible by the certainties of the roadmap and the vaccines. Last question from Tim Ross of Bloomberg.
Prime Minister, before we get to July the 19th, there are some football matches coming up, and I just wondered what your message was really to football fans who are planning to celebrate and businesses who are planning to accommodate them. Are you concerned that in any way this could trigger some kind of super spreader event? We saw what happened with Cheltenham last year. And to Chris Whitty and Patrick Vallance, we know that you model these things because you have released SAGE documents showing as much. This is quite a big moment for the country, and transparency is pretty important. So can you level with us all now and say exactly how many excess deaths, extra deaths, these relaxations are likely to cause, according to your best modelling estimates?
Tim, I think my advice to everybody would be to obviously to support England, but enthusiastically, but in a responsible way. And the events at Wembley clearly have particular conditions attached to them, particular testing requirements, which we will insist on.
Just a quick point on that. I mean, again, the risk of spreading is greatest indoors environments, and therefore it's very often not the big outdoor environment itself, it's the indoor environments with crowded spaces around that become the risk for spreading, and that's where most super spreading events have occurred, in those sorts of environments. In terms of the modelling, everything is made public. The models that have been done at the start of the roadmap and subsequently are there for people to see. They are just models, and therefore you have to take with some caution the absolute amounts. There's very wide uncertainty around it. What I will say is the modelling has been really quite accurate in terms of timing of the onset of this wave, and we're due more modelling next week in the run-up to the decision on the 12th, and that will be made public in the usual way.
Great. Thanks, everybody. Thank you very much. Thank you.